right. Hi, James.
Hello.
Welcome to the clinic.
Thank you so much.
How are you feeling today?
I'm okay. I've had better days.
Okay. So it looks like you're in for an ENT exam today.
That's correct.
All right. Well, my name is Dr. Perez.
Okay.
It's nice to meet you. I will be your ENT specialist today.
All right.
Can you tell me a little bit about what brings you in?
Yes, I'm just having some issues. Having some runny nose issues, some runny eye issues, scratchy throat every now and then. I don't think it's quite an ear ache, but I do have a slight pain with my ears, like a aching sort of pain. Just in this whole general region, it's just, I don't know what's going on.
Sounds like you're maybe having some issues with either an allergy or seasonal allergies. Which ear are you having the pain in?
This ear, my right ear.
Okay. Right here. All right. Let me just go over a couple of things with you. I will be taking some notes as we kind of go on.
Okay.
So I'm hoping it's not something more serious like an allergic reaction, but we'll have to do some tests to kind of determine a little bit more about what's going on and help me pinpoint a diagnosis.
Okay.
Can you tell me how long you've been experiencing these symptoms? Like a couple days, a couple weeks?
It's been about a week now.
About a week?
About 6 or 7 days.
Okay. And has it progressively gotten worse over the course of those days, or is it about the same?
It's gotten worse.
Gotten worse. Okay.
Yeah.
Got it. And are you in pain currently?
I'm not in pain, just a dull ear ache.
Dull, okay.
It doesn't really hurt, but I can tell that it's there, if that makes any sense.
So it's just kind of dull and achy.
Yeah.
Are you able to grade that on a scale? Like if you were to give me a 1 to 10?
A 2.
2.
Yeah.
Okay. And is your pain localized just to that area, or is it kind of...
Yeah, it's localized
sometimes ear pain can radiate
to my ear a little bit, kind of to my neck, kind of just in
down.
this.
Okay.
Yeah.
Got it. Okay, any sharp stabbing pain?
No.
Okay, good. And have you been experiencing any fevers or localized heat kind of in your ear that you've noticed, or just a general fever?
It is a little bit warm around the area, yeah. Just in the ear area.
Okay. Do you have any known allergies or family history of allergies?
Just a seasonal
Just
allergy.
Seasonal, nothing specific, no allergies to medication or anything like that?
No, none.
Okay, no known medical allergies. That's good to know. And have you ever experienced this before? Like, is this something that kind of comes and goes certain times of the year, or this is like a first time?
This is all brand new.
So you're not typically a person who experiences seasonal allergies as far as you're aware?
No.
Okay. Are you new to the area by chance?
No, I'm not.
Okay. Any issues with any kind of chronic infection, such as tonsillitis, strep throat, flu? Do you tend to get sick every year?
No, I don't.
Okay, so pretty healthy in general. Have you ever had strep throat?
I don't think so.
Have you ever had influenza?
Yes, I've had the flu before.
Okay, recently?
No, it's been years.
Okay. And are you up to date on your vaccinations?
I am.
Okay. All right. Have you ever been diagnosed with COVID?
I have, yes, one time.
Do you remember when?
It's been about a year now.
Okay. So 1 year since you've had COVID or any COVID symptoms.
That's correct.
Perfect. So we can probably rule that out.
Yeah.
Are you having any symptoms of any respiratory diseases like shortness of breath, asthma?
No.
Any wheeziness?
Nope, none of that.
Dry cough? Nothing like that?
No.
Okay. No rapid breathing?
Nah.
Okay, perfect. Okay, and do you have any suspicions that you might be allergic to anything specific or anything in particular?
Not that I know of. I can't think of anything. I've been thinking about it, trying to figure it out, but...
Nothing that you can kind of pinpoint to think would be causing these problems?
Not at all.
Perfect. So I do have kind of a better idea of what I think might be going on.
Okay.
I do want to do a brief physical portion.
Okay.
You did say you were having some ear pain,
Yes.
so I definitely want to have a look at that.
Okay.
And just kind of in general, I would like to have a look at your eyes, your nose, the back of your throat, make sure there's no kind of obvious agitation that might be causing this.
Okay.
I'm leaning towards seasonal allergies,
Right.
even though that's not something that you have in your history.
Right.
It could be something new. We have a lot of pollen this year.
Yes.
So definitely something to look into. All right, so let me go ahead and have a look. I'm gonna get on a pair of gloves.
Okay.
So I will be touching your face. Obviously, I'll be careful with that
Okay.
right ear. Just move my table here. Okay. So I'm going to start off by having a look in your eyes. Do you
Okay.
mind removing your glasses?
Sure.
Perfect. Okay. All right, so I'm just going to have a look at your face kind of as a whole. I'm looking for any noticeable swelling in your maxillary sinus areas, which I'm not seeing right now. You did say you were having some issues with nasal drip and kind of eye watering, which I'm not noticing just yet. Is that something you had like this morning or at some point today?
Yeah, this morning for sure.
Okay. Right now it looks okay. I'm just going to lift up your eyelid. I'm going to put just a little bit of pressure on your tear ducts. Let me know if this is uncomfortable or if you feel like a fullness. Does that feel okay?
Yeah, it's just almost making this eye want to tear a little
Okay,
bit.
so putting pressure there is,
Yes.
so I'm going to do that down your kind of outward nasal passages here. Does this feel uncomfortable or do you feel like a fullness there, like your sinuses are maybe
Yeah, on the right side.
on the right side?
Yeah.
Okay, so more so here
Yes.
than here.
Yes, absolutely.
And if we go out a little bit,
Nothing.
not as much.
No.
Okay. All right, can I have you just turn your head for me? So I'm gonna look at your ear. I'm gonna pull kind of up and out. Is that uncomfortable or painful?
No, it's not.
If we do down
Well, slightly, yeah.
a little bit,
I can feel it. It's not too painful, but I notice it.
and if I put a little bit of pressure here, a
yeah.
little bit uncomfortable there. Okay. And you said that pain was radiating slightly down your neck.
That's correct.
Do you notice maybe some slight swelling in the lymph node here?
Yep.
Is that painful?
Slightly.
A little uncomfortable. So the good news is I'm not noticing any signs of abnormal discharge or secretions. It doesn't look like you have an overload of earwax. I'm going to turn your head in the opposite direction for just a second. No pain or discomfort with this side, correct?
No, none at all.
All of this feels okay. And nothing here.
No.
Okay. All right, so I'm not suspecting any kind of ear infection or damage to your eardrum.
Okay.
I do want to do a brief hearing test,
Okay.
just to rule out any hearing loss.
Okay.
But I'm guessing this is probably due to just sinus overload that's putting pressure on your ear.
Right.
So I am going to test your eardrum
Okay.
by putting a slight puff of air inside your ear.
Okay.
If this causes you any pain, let me know. If it does, we might be worried about something more serious happening with your tympanic membrane, okay? So I'll have you turn your head for me. Go ahead and close your eyes. I want you to say yes when you feel this and tell me if it's painful.
Okay. Yes. Yes, it's not painful though.
A little more in the ear now.
A little bit more painful, yeah. Yes, I hear it. It's a little bit more painful.
A little bit more painful.
Yeah.
Okay. Let's go ahead and do the other side. I'm just going to do a couple here.
Yes, I hear it.
Any
I hear it.
pain or discomfort there?
No, there's no pain.
Okay. I'm going to have you open your eyes wide for me.
Okay.
Normal reaction there. I was looking for that kind of natural reaction to blink, and you did blink, so that's great. Okay, so let me just do one more ocular motor test. My headlight will cooperate here. Okay, so I'm gonna have you look straight ahead. I want you to keep your head fixated and follow the light with your eyes. Any pain or discomfort, double vision, blurry vision?
No.
Okay, I do notice some slight watering on the right side.
Right.
Okay. And the last thing I want to do is test your reflex in your eye. So I'm going to be putting a cotton bud at the corner of the outside of your eye, and it should make you blink. So open your eyes for me. Good. I know it's uncomfortable. I apologize, but it is. Okay, so definitely getting a little bit of an overreaction on this side.
Right.
Are you experiencing some sensitivity there now?
I am.
Probably from the light.
Yeah.
Okay. All right, so I'm gonna have a look at your nose. If I could have you tilt your head back for me. Just looking for any visible occlusions. Not seeing anything just yet. Don't appear to have a runny nose at this time. I'm gonna occlude one side here. Take a breath in for me. And the other side. Both sides, breathe through your mouth. Okay, so no kind of notable occlusions at this time. It sounds like your nasal patency is equal and bilateral on both sides. I'm gonna do a brief smell test.
Okay.
So I'll have you close your eyes. I'm gonna occlude one nair and want you to tell me what you smell on the other side, okay?
Lemon.
Very good, that's lemongrass. We'll do the other side. So it's a little harder.
Like herbal tea.
It's tea tree, very good. Very good. That one is a little more difficult, so it's good that you were able to tell what it was. Okay, let's go ahead and move on to a brief oral exam. I'm just going to get my tongue depressor here. So if I can have you stick out your tongue and say, ah. Good, look at the back of your throat. You look at the hard palate. Can I have you lift your tongue up to the top of your mouth, just looking at the soft palate? Okay, not noticing any abnormalities. Is that uncomfortable? Okay, so this is going to be slightly uncomfortable. I do need to test your gag reflex, so I want you to just relax. Go ahead and close your eyes and stick your tongue out for me. Okay, thank you. I'm sorry. You did very well with that. Tonsils look normal. I didn't notice any swelling or any signs of tonsil stones.
Okay.
You don't have any discoloration or nodules at the back of your throat, so I definitely don't think you have strep or anything like that. How many times a day would you say you brush your teeth?
Twice a day.
And floss?
Once a day. Maybe once every other day. I need to get a little better at that.
Okay. Do you use mouthwash?
Yes.
Daily?
Yes.
Perfect. Okay. So next thing I want to do is test your facial strength. Make sure we're not having any loss of the facial muscles in your face.
Excuse me.
No problem. You ready?
Mm-hmm.
Okay. So I'm going to have you puff out your cheeks. Don't let me push them in. Okay. Do that one more time. Okay. Can I have you move your tongue to one side? Don't let me push it in. And the other side. Very good. Now kind of brown your lips. Very good. Okay. So no issues with that. And the last thing I want to do for your oral exam is what's called a smile test. So first I'll have you smile with no teeth. Just checking for any asymmetry. And smile with top teeth only.
Top teeth only?
Top teeth only. I know it feels a little silly.
It does.
Very
Very
good.
weird. I don't know which way is top teeth.
Okay, no, you can do full teeth, smile. Very good. Okay, no issues with that. I apologize. I know it feels a little silly, but you did very good.
Thank you.
Essentially, that tests your facial muscles and the jawline. Make sure there's no discrepancies with that, but you did very well. Okay, so let's go ahead and roll that out. Very good. And the last thing I want to do for your ENT exam, besides testing your sensation, is I'm going to do a very brief hearing test.
Okay.
So I will test the left side just to make sure you can hear. So close your eyes for me. You hear that?
Yes.
Does it sound farther away now?
Yes, it does.
Tell me when it gets closer.
It's closer.
Okay, so no discrepancies on your left. So we'll do a little more of an in-depth test on your right.
Okay.
Can you hear that?
Yes, I can.
Is that uncomfortable at all?
Slightly,
Slightly
yes.
uncomfortable. Okay, I'm going to move it farther away. Tell me when you hear it up closer.
Closer.
Very good. Tell me what sounds closer, 1 or 2?
2.
And now 1 or 2?
1.
Very good. Okay, I'm going to make a sound with my hands. Can you hear that?
Yes.
Okay, tell me when it gets farther away
It's farther.
and closer.
Closer.
Tell me which is closer, 1 or 2? 1, 2.
1 is closer.
1, 2.
2 is closer.
1, 2.
2 is closer.
Okay. I'm going to occlude this side and whisper something in your ear, and I want you to just tell me what it is.
Okay. Okay. Therapy cat.
Very good. Therapy cat.
Therapy cat.
Okay. So I'm not noticing any issues with your ears or hearing, which is good news. All right, James. So one of the last things we're going to do is test for any issues with ocular occlusion.
Okay.
So this is going to help me determine if the swelling that's in your nasal passageway is occluding your eyes too much.
Okay.
So what I want you to do is hold this up to your eye. It's obviously going to completely occlude one side.
Mm-hmm.
Are you able to see my hand here?
Yes.
Tell me how many fingers I'm holding up.
2. 4. 5.
Very good. Go ahead and switch. Can you see my hand?
Yes. 2. 3. 5.
Very good. Okay, so no issues with ocular occlusion, which is great. And the last thing we're going to do is test your facial sensation. And I'm going to do that a couple different ways.
Okay.
So this might be slightly uncomfortable. I'm going to be using a reflex hammer to put pressure on your nasal passageways.
Okay.
So it might feel kind of uncomfortable. If
All
it's painful, let me know, okay?
Sure.
So I'll have you close your eyes. Tell me if this is on the left or the right.
The left. The right. The middle. The right. The left.
Is any of that uncomfortable?
No, it wasn't.
So I want you to open your eyes. Try to keep your eyes open, but don't force yourself not to blink. I'm going to test your ocular reflexes, so I'm going to have you look straight ahead. Very good. Keep looking ahead. Okay. One more time. So mostly normal reaction. I did notice a little bit of an overreaction again on the right side.
Yes.
So now I'm going to test your sense for sharp or dull. So can I have you hold your hand out for me? So this is dull.
Okay.
And this is sharp.
Okay.
Can you tell the distinction there?
Yes, I can.
So go ahead and close your eyes for me. I'm going to do this on your face. I want you to tell me if you feel sharp or dull.
Okay. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
So we are all done with the sensation portion. You did miss a couple that were right over your maxillary sinus.
I think I realized that after.
Yeah, I think it's probably due just, you have a little bit of swelling going on, so that sinus pressure is kind of occluding your neurological senses, but that's okay. Okay, let me just take a couple of notes here.
Okay.
Okay. All right, James, the last thing we're going to do before we begin your allergy exam is I want you to take a drink of this water.
Okay.
We're going to do it in 2 sips, so drink half and then hold it. Very good. Okay, so no issues with that. So let's go ahead and move on to the allergy test portion of the exam. I'm going to be placing this on your lap, if that's okay, just to keep your clothes free of any debris.
Okay.
And whatever way is comfortable for you to rest your arm.
Okay.
Is that okay?
Yeah, that's
okay.
fine.
So I'll test this area if that's fine with you.
Yep.
And I'm going to begin by just cleansing the area. So I have some gauze here. I'm going to be spraying just a little bit of sterile water.
Okay.
Okay, and then I have just a Castile soap that I'll be using to cleanse the area. So I'm going to use just a little bit of this. Very good. Okay. I apologize, it's a little cold.
That's fine.
I'm going to spray one more time.
Okay.
Okay, so we'll let that air dry for just a second. And while that dries, I'll go over the allergy test with you. So I have a series of allergens here, and I will be applying them with a cotton tip applicator. Essentially, we're testing for seasonal allergies. I don't think you have any specific allergens that we need to be looking for. You have cats, obviously, so I'm not worried about that being an onset allergen. I do think this is probably more so related to the increase in pollen that we've seen this year.
Yeah.
We do have a couple foreign plants that have been brought over with the on-rise of COVID and shipping manufacturers and stuff. Unfortunately, we're getting some foreign pollen substances brought over. So a lot of people have been having issues with that because you're being susceptible to plants that you've never experienced before. So they're causing allergies in people my patients who never usually have seasonal allergies. So I know it's unfortunate, but I'm guessing that's probably what's going on.
Okay.
So it does look like the area has dried. So I will go ahead and begin applying the allergens, and nothing too specific. I'm just going to be applying them in a grid kind of visually from top to bottom. So I will start here. And hopefully we'll get a reaction so we can kind of tell a little bit better what's going on. very common allergens in here, but there are also a couple that are more foreign. So I do have things like wheatgrass. There are a couple different types of weeds. There's a tree native to the area that a lot of people tend to be allergic to, so we're also testing for that.
Okay.
Starting on our second grid here. These last three are the foreign substance allergens.
Okay.
So these would be the most likely to react positively,
Okay.
simply because you haven't come in contact with them before. Okay, coming up on our last one. Okay. So we are going to let these sit for about 20 minutes.
Okay.
Whichever way is comfortable, as long as you don't turn your arm in a way that would
Gotcha.
affect the test.
Okay.
I will leave you for a couple minutes and I'll come back and check to see how we're doing, okay?
Okay,
All
cool.
right, I'll see you soon.
All right.
All right, James, let's go ahead and have a look. I am seeing a couple positive reactions,
Yeah.
and as suspected, it's on the foreign allergy chart. So I'm just gonna have a look with my pen light here. Are you experiencing any itchiness?
I don't think so.
Okay. So we do have a couple mild visible reactions here. So as you can see, there are no raised areas on our first grid. All of that looks normal, but we do have just some slight swelling and agitation here.
Right.
Okay. So as suspected, you are experiencing some seasonal allergies here to those foreign substances. Fortunately, the reactions are not severe enough that I'm suspecting you're, at risk for anything like anaphylaxis or anything more serious. But
Good.
unfortunately, with the rise in these shipments, these plants are likely to continue coming over. So you will be in contact with them more frequently. Do you ever take anything like Claritin or Allegra, Benadryl if it's more severe?
Every now and then, yeah.
Every now and then, okay. Let's start a measure of these more positive reactions. They are very small and not what I would consider super significant. Okay. So definitely recommend taking kind of a daily Antihistamine.
Okay.
I usually recommend Claritin to my patients because it's the most gentle but seems to be pretty effective.
Okay.
If you're experiencing these at night, most people tend to kind of wake up with them in the morning.
Yeah.
It depends on what time of day you've been outside, but if this is something you're experiencing at night, I would recommend taking something like a Benadryl because it also will help you sleep
Right.
and hopefully wake up a little more clear.
Okay.
If it's not super severe, you could take a Claritin and hopefully that'll get you through the day. They do have Claritin 24 hours.
Yep.
I don't recommend taking it every day if you don't need it.
Yeah.
The thing about allergy medication is people tend to become immune to it. So
Right.
if you take Claritin every day for 30, 60, 90 days,
Right.
you probably will have to switch to something else, like switch to an Allegra, and then maybe switch back to a Claritin. A lot of people have to go back and forth because your immune system starts to build up a tolerance to the medication. So at this point, if you're feeling uncomfortable enough on a daily basis, you can go ahead and take something like that if you feel like it's necessary.
Okay.
The good news is I don't think you're having, like I said, any kind of ear infection. I don't think you have any nasal polyps or anything like that. Obviously, the discomfort in your eyes is just due to the sinus buildup. So
Right.
some at-home treatments you could do for that is taking a hot shower, sitting in the bathroom. If you have access to like a steam room at your
Right.
gym or something, that might be a good idea just to help get rid of some of that sinus pressure.
That makes sense.
You're not contagious or anything like that, so you don't have to worry about getting other people sick. This isn't like a virus or
Right.
a bacterial infection or anything like that. It is just seasonal allergies, which is, good news.
Cool.
You might want to look into some eye drops. So they have dryness drops, moisturizing drops. I know you said you kind of tend to wake up with more dry eyes.
Yeah, absolutely.
So you might want to use some moisturizing drops in the morning. But if your eyes are overly watery, especially that right side, I was noticing some kind of tearing in the right side. You might want to use some drops that will help with that at nighttime, okay?
Sure.
All right. So make sure you're staying hydrated. That's going to be a big thing.
Okay.
Let me go ahead and clean this area for you. And I'm just going to apply a little bit of a honey gel. It's just a therapeutic gel that will help get rid of some of that outward swelling so you're not going home feeling uncomfortable, because I don't want that
Right.
to irritate you for the rest of the day. Do you have any questions for me?
No, I don't think so. That was very thorough. Thank you.
Okay, perfect. Hopefully your symptoms won't get any worse. If they do and you start to feel like you're not getting any better or the Claritin's not helping, especially if that ear gets worse or you
Right.
start experiencing any inner ear pain or any type of abnormal discharge or change in your earwax, I definitely want you to come back, because that might mean that we're looking at something more severe with that right ear, okay? But other than that, I honestly think you'll be okay with some just kind of day-to-day allergy medication. So this is just therapeutic honey gel, and essentially it'll just help take away some of the inflammation on these positive reactions that we got. So I'll just go ahead and rub that on for you. It is going to feel a little bit sticky.
Yeah.
But it will help with any inflammation. This is also really good for bee stings, mosquito bites, anything like that. That should provide you with some relief, at least topically.
Yeah.
If you go home and you feel like your symptoms have worsened, I would probably just take a Benadryl and you should be okay.
Okay.
Just making sure we really got it in. Okay. All right, James. Well, you are welcome to wash your hands on the way out if you'd like.
Okay.
And I can write you a prescription for the Claritin if you'd like, but it's an over-the-counter, so you're able to just pick it up at your local pharmacy.
Okay.
Okay?
Yep.
So like I said, if your symptoms worsen, please come back and we'll have another look. But other than that, I think you're going to be okay.
All right, cool.
All right. Thank you so much. Have a good day.
You're welcome. Thank you.